Every state, every city, every county has some type of plan for this emergency. It's not terrorism, but it could be far more devastating to life and the economy. The H5N1 virus, or the pandemic influenza virus. The good news is that should a pandemic flu reach Arizona, we do have plans to deal with it. We tested one such plan for Arizona State University in 2008, but as every state and federal agency tells us, there's more work to be done. Most plans pay attention to healthcare systems and medical supplies. What's not fully understood is how the pandemic flu might impact public school systems, and how closing the schools could impact other parts of the state and the economy. To address this gap in pandemic planning, researchers at Arizona State University's Decision Theater conducted a two-part school closure exercise.
The goal of this exercise will be to encourage the individuals in school districts to continue influenza pandemic planning and to effectively be able to communicate with public health authorities in both their local counties and at the state level.
Our exercise, it includes elements of being a discussion-based program, also a tabletop exercise, a tabletop game, because it is interactive, and we can do functional aspects of it as well, because using the Decision Theater environment as our decision-making environment, we can add in components that make it look like it's some type of emergency operations center and have that level of communications ongoing throughout the exercises.
43 attendees from 3 counties, Maricopa, Pinal, and Coconino counties, took part in this exercise. It included interactive, multimedia, and brainstorming sessions, featuring data, threat levels, and simulated news updates as the pandemic spread in waves across the counties.
And that's the key to using the Homeland Security protocols for developing these exercises. There's automatically a mechanism for using the standard protocols that make it transportable, but also it goes into federal databases, and so we can share this information with other groups of exercisers when they're developing their exercises as well.
The consequence of the epidemic is going to be spread throughout the community, and there will be both economic consequences and social consequences that are going to be they're going to weigh very heavily on the minds of people who have to make decisions.
The pandemic flu model used in this study, known as the differential equation-based mathematical epidemiological model, was created at the Decision Theater by Oscar Araz and Dr. Tim Lant.
The goal is to have people prepared. The goal is to save lives in the event of emergency situations and crises. So to the extent that we can widely disseminate what we're doing here and other people can borrow from it and learn from it, and we can collaborate with them. Ideally, we should have a more prepared network of people across the United States and the world.
I think overall the response was fairly positive. People were impressed with the media, and at least the feedback that we've been getting as people have been leaving is that people thought the interactive nature of the exercise was great. They loved the graphics, they loved the simulations, they loved the media. So I think overall it really helped take the exercise to another level and really improve decision making.
I think being in the room with not only other school districts, but also the benefit, the huge benefit to us was to be able to hear the county's response and the medical profession's response and agency's response. So that was very helpful, because when an emergency occurs and we need to implement plans, we need to be working collaboratively.
The outcome of the exercise now informs and updates each of the school's pandemic preparedness plans, and gives those public health officials in each county a better understanding of how to work together in a real health emergency like this. The exercise was conducted at the Decision Theater in collaboration with the Arizona Department of Health Services.